Hello guys, I am from Gandhinath Ranji College of D Pharmacy, Solapur. Today we'll see the 9th chapter, that is antifungal agents. First we will see the what is meant by fungi. Fungi are the heterotrophic microorganisms that are differ from the algae by the lack of photosynthetic ability. They differ from the protozoa by lack of motility. They differ from the bacteria by greater size. Disease caused by any fungus is known as the mycosis. आता आपल्या ह्याच्यामध्ये फंगाय दीज आर दी हेट्रोट्रोपिक. तर हेट्रोट्रोपिक म्हणजे काय? तर हेट्रोट्रोपिक म्हणजे काय? दॅट इज दी नॉट सिंथेसाइज दी फूड डिपेंड्स अपॉन दी अदर. जे काही फंगाय असतात ते स्वतः अन्न तयार करत नाहीत, ते स्वतः फूड तयार करू शकत नाहीत. दॅट दे आर बी डिपेंडिंग अपॉन दी अदर. तर आपण म्हणतो हेट्रोट्रोपिक. They are differ from the other, that is like they are differ from algae by lack of photosynthetic ability. आता algae आपण बघितलं तर algae these are the photosynthesis करतात, ते स्वतःचं फूड स्वतः तयार करतात, पण फंगाय तयार करू शकत नाही. दे ऑल्सो डिफर फ्रॉम द प्रोटोझोआ बाय लॅक ऑफ मोटिलिटी. फंगाय आपला मोटिलिटी दाखवत नाही जसं प्रोटोझोआ दाखवतो. दे ऑल्सो डिफर फ्रॉम द बॅक्टेरिया बाय ग्रेटर साईज. बॅक्टेरिया हे साईजनी मोठे असतात पण फंगाय नाही. Disease caused by any fungus is known as the mycosis. Next we will see the classification of antifungal agents. In that first we will see the synthetic compounds, second one is the natural products. First is the synthetic compounds. In that first we will see the carboxylic acid and their metallic salts. The example they are given: undecyanic acid, that is also called as undecinoic acid. Zinc, next one is zinc undecinoate. Next second, that is dyes. Example gentian violet, that is also called as crystal violet. Malachite green. Next one is the phenolic compounds, that is salicylic acid. Next one is the diamidines. The examples are the example is stilbamidine. Next one is the thiocarbonylic acid derivatives. The example is tolnaflate. The next one is the azoles, or it is also called as imidazoles because they containing the imidazole ring. The example is miconazole and clotrimazole. Next one is the natural products. In that first is that is antibiotics. In that first one is the antibacterial antibiotics, that is example griseofulvin. Next one is the Pauline antifungal antibiotics. Tetrins, the example is nystatin, amphotericin A. Next one is the pentins, the example pentamycin. Next one is the heptanes, the example is amphotericin B and hamycin. These are the some example or classification of the antifungal agents. These are very important classification. Next we will see the first drug, that is undecyanic acid or undecinoic acid. याचं आपण फिजिकल प्रॉपर्टी बघूया. दॅट इज कलरलेस और पेल ब्राउनिश क्लिअर लिक्विड, कॅरेक्टरिस्टिक ओडर, बिटर टेस्ट अँड सोल्युबल इन वॉटर अँड अल्कोहोल. नेक्स्ट इज द स्टॅबिलिटी अँड स्टोरेज. इट इज अफेक्टेड बाय लाईट and hence stored in the tightly closed light resistant containers at a temperature between 80 degrees Celsius and 15 degrees Celsius. Next is the uses. It is used as topical fungicidal. टॉपिकल म्हणजे आपण स्किनवर लावू शकतो, आपण इंटरनली घेऊ शकत नाही, तर आपण म्हणतो टॉपिकल फंगिसाइडल. And also it is internally it is used to treat the psoriasis and neurodermatitis. The psoriasis म्हणजे काय? This is the one type of the skin disease. The symptoms are red, itchy and scaly patches. That is the symptoms of psoriasis. And also neurodermatitis. The symptoms are patch of itchy skin. that are the symptoms of neurodermatitis. In this case, we are use this drug. The pharmaceutical formulations: compound undesalinic acid. Next one is the zinc undecinoate dusting powder. These are the two formulations. The brand name is Mycota and Tinifax. These are the two brand names. Next drug is the Tolnaflate. It is the white or creamy-white crystalline powder, odorless, practically insoluble in water, very slightly soluble in alcohol but freely soluble in chloroform. It is also stored in tightly closed containers. Next one we will see the important, that is uses. It is topical antifungal agent and used for the treatment of various forms of ringworms. We can also use to treat the ringworms or kill the ringworms. It is not useful for the deep infections of nails and hairs. जे का आपले नेल्स असतील नाहीतर हेअर्स असतील नाहीतर हेअर फॉलिकल असतील, जर डीप इन्फेक्शन झालं असेल तर हे नॉट युजफुल. बट इन कॉम्बिनेशन विथ ड्रेसिफुलिन इट इज यूज टू ट्रीट दी सिस्टेमिक इन्फेक्शन. सिस्टेमिक इन्फेक्शन म्हणजे काय, आपण हे ब्लडमध्ये देऊ शकतो, त्याला आपण म्हणतो सिस्टेमिक इन्फेक्शन. जर कधी सिस्टेमिक इन्फेक्शन झालं असेल, फंगल इन्फेक्शन, त्या केसमध्ये आपण हे ड्रग देऊ शकतो इन कॉम्बिनेशन विथ दी ग्रेसिओफुल्विन. दिस आर द टू युजेस. It is in the form of topical solution, powder, aerosols, creams, gels. The brand names is Tanacid, Multiderm and Mycil. These are the some brand names. Next drug is Nystatin. It is yellow to light brown powder, cereal-like odors, hygroscopic and very slightly soluble in water and in alcohol. तर सिरियल लाईक ऑर्डर्स म्हणजे काय, जे आपल्या घरी अन्नधान्य असतं, जे कडन गहू तांदूळ असतो, त्याचा जे वास येतो, रफ वास येतो, त्याला आपण म्हणतो सिरियल लाईक ऑर्डर्स. इट इज हायग्रोस्कोपिक अँड अफेक्टेड बाय रूम टेम्परेचर, लाईट अँड एअर. हेन्स इट इज स्टोर्ड इन टाईटली क्लोज्ड लाईट रेजिस्टंट कंटेनर्स ॲट ए टेम्परेचर नॉट एक्सिडिंग 5 degrees Celsius. Next one that is very important, that is uses. It is an antifungal and used for treatment of candidiasis of skin and mucous membrane. आता कॅन्डिडियासिस म्हणजे काय, तर कॅन्डिडा एक प्रकारचं फंगस आहे, त्याच्यापासून जे काही डिसीज होतो त्याला आपण म्हणतो कॅन्डिडियासिस ऑफ स्किन अँड म्युकस मेम्ब्रेन. त्याला ट्रीट करण्यासाठी आपण हे ड्रग यूज करतो. ऑल्सो फॉर ट्रीटमेंट ऑफ इंटेस्टिनल अँड इसोफेगल candidiasis, also for candidiasis of mouth and also candidiasis of vagina. In this case we are use this drug. It is in the form of cream, ointment, tablet, oral suspension, eye drops, lotion, pessaries, vaginal tablets, topical powders and ointment. These are some pharmaceutical formulations. The brand name is Nistan, Nistaform and Nistadermal. Next one is the Amphotericin B. Next that is, it is in the form of yellow to orange powder, odorless, tasteless, practically insoluble in water and in alcohol, but soluble in dimethyl sulfoxide and in propylene glycol. These are the some physical properties. It is affected by light, air and room temperature, hence it is stored in tightly closed light resistant containers at a temperature 2 to 10 degrees Celsius. Next one is the uses. It is used to treat mucocutaneous and cutaneous leishmaniasis and candidiasis. आता आपल्याला माहिती आहे कॅन्डिडियासिस म्हणजे काय, कॅन्डिडा या फंगसपासून डिसीज झाला असतो. आणि लेशमिनियासिस म्हणजे काय, दिस डिसीज कॉज्ड बाय द बाईट ऑफ सँडफ्लाईज जर बाईट झालं असेल त्याच्यामुळं लेशमिनियासिस हे डिसीज होतो. ते क्युअर करण्यासाठी आपण हे ड्रग यूज करतो. इट इज यूज फॉर सस्पेन्शन ऑफ ओरल ऑर इंटेस्टिनल कॅन्डिडियासिस. इट इज ऑल्सो ॲक्ट एज अ ब्रॉड स्पेक्ट्रम अँटीफंगल ॲक्टिव्हिटी. दीज आर दी सम uses. It's in the form of cream, lotion, lozenges, ointment, injection and mixture. The brand names are Fungizone and Fungilin. These are the two brand names. The last drug that is Hemicin, or it is also called as Prima mycin. It is in the form of yellow amorphous powder, amphoteric in nature and soluble in pyridine but practically insoluble in water and chloroform. आता amphotericin म्हणजे काय? This is act as a acid or base. It is also affected by light and air, hence it is stored in tightly closed light resistant containers. The next one is the uses. It is an antifungal and anti-trichomonal activity. The trichomonal, this is one type of the parasites that can kill, so it is called as an anti-trichomonal activity. It is also used topically and orally in various fungal infections. These are the two uses. It is in the form of ointment and vaginal tablets. The brand name is Imprina. This is the brand name, and this is completes the antifungal agents. Thank you.